All right, so let's actually talk about what is integrative medicine. You know, one of the tricks about alternative medicine, holistic medicine, non-conventional medicine, alternative and complementary medicine is there's so many words for this field, and those words come out of the fact that nobody knows what to call it, and so I just call it medicine. Medicine is stuff that we use to help things get better. And there's different kinds of medicine, and just like we can say that we have pharmaceutical medicine and herbal medicine, I think that's fine. But these terms come up and they're important and we need to use them correctly. So the big question is, what is integrative medicine? To bring together, to be whole. And all of us that had math all know about integers. Integers are whole numbers like 1, 2, 3, and 4. Fractions, parts of numbers, are not integers, right? They're non-integral. So when we start putting things together, we want to make things whole. Now, I even go further when we look at medicine, and I think that integrative medicine is that medicine that we know about. And so what we're looking for when we use this word integrative medicine is it's not just that it's different from what conventional medicine does, it's not just acupuncture, it's not just chiropractic, it's not just herbal medicine or homeopathy. Integrative medicine is actually using the parts of medicine that work and using them correctly. Susan Wynn, who's an ex-president of the American Holistic Veterinary Medical Association, says it really clearly. She says, integrative medicine is knowing the tools you have and knowing how to use them. And as veterinarians, all of us, regardless of what kind of medicine we practice, would be pretty quick to admit that we don't have solutions for all the medical conditions that our patients come in with. And our obligation, the tie that binds us as professionals, is to find solutions for these patients, whether we can make a diagnosis or identify their pathology or not. So integrative medicine are those parts of pioneering fields of medicine where we have some studies or we have some scientific facts that support the use of those particular agents. Holistic medicine has to do with viewing a patient as an entity which is part of a greater whole, which is interrelated to its environment and to the people and other things that are there. Complementary and alternative medicine was a term that was created to get away from holistic medicine, because they still couldn't define that term well. And complementary and alternative medicine is medicine that complements conventional medicine and also is an alternative to conventional medicine. Now, we who do complementary and alternative medicine or integrative medicine don't actually like that term because it implies somehow or other that conventional medicine is better or worse and that we need an alternative to it. And that alternative medicine is somehow better or worse. There's like two systems of medicine. We have medicine and then alternative medicine. Well, honestly, if you do this module where we look at things as the metaphor, the umbrella metaphor, which is what I call it, which is you have life and all these activities and all these different organisms and species that are there. And over life, we have this umbrella, which is medicine. And medicine actually has to encompass and involve solutions to the problems that are encountered by everything that's under the umbrella. So human medicine covers those things that have to do with people staying well, getting sick and getting better. And veterinary medicine has to do with everything else that has to do with animal life. It's a big umbrella. So integrative medicine is just those different kinds of medicine that go together and that have some scientific basis of truth that we can then use in a more predictable fashion as doctors. And when we do that, we bring those little triangles of the umbrella together and we make the umbrella more whole, so it protects us. So medicine is part of life. It's not better, it's not higher, it's the knowledge that is medicine is part of the overall bit of information that we use. And that whole idea of an umbrella is actually protecting us against disease. And medicine can protect us against disease, but actually that's not its primary role. Its primary role is to help us live better.